Okay. Or just seeing how it looks and actually this is PTD, and we are going to do a Desferal injection. We're going to show you how to do it. So we are going
to need a quick set.
Yeah, we're going to need a Medtronic quick set. One of these. You probably can't see it, but it's one of those. We are also going to need a what are they called again?
Connector.
A connector to connect the needle thing to the syringe, the quick set to the syringe, which is with the medication. And what we did before, we have to put the syringe in the auto driver machine, because then it does it overnight, like slowly kind of
3 millimeters per hour.
Yeah, it does 3 millimeters per hour, pushes in, because if it goes too fast, you get a rash.
We also need
alcohol prep pads for to clean it up, because you don't want dirty stuff getting in your stomach. So we first put Emla cream, as you saw with the white stuff, to numb the area, so that it wouldn't hurt at all. It wouldn't hurt at all if when I get injected, but
you need to leave the Emla cream for about 45 minutes
or an hour, or more than an hour. I like to do more than an hour, because then it gets super duper numb, as I like to say it. And so Mommy is going to get an alcohol prep pad and clean the area.
15 seconds.
15 seconds.
And we had to wait a little bit to dry. Meantime, separate to make sure that it's not so sticky.
So that it hurts to take it off. So Also, what's gonna happen is that when the needle goes in me, they're gonna take out the needle like they do or they're gonna take out the needle, and it's just gonna be a little plastic flimsy tube inside me, so it won't hurt at all. And
Okay, so we need to take this cap off, in that way we can expose the needle,
so that the needle will be out and the needle won't be blocked. All right. I usually like to close my eyes so that I don't see it and it doesn't hurt.
You squeeze the belly in this way. You grab the needle and stick it in there. Then you grab the part that you get the sticker off to peel it off.
You get that little white sticker thing and you take it off, the one that we were talking about earlier, that you had to peel off a little bit so that it wouldn't be as sticky and, like I said, hurt as much. And then that blue thing at the top, you take it out, because that takes out the needle.
That's the needle. And
that's the needle. And then you get that blue thing and you push it against that needle. And
so we get it all in now.
Yep, now it's all in, and all that's in my stomach is a plastic thing. So we take off that white thing, and now we're going to have to connect everything together like a puzzle piece. Like a puzzle.
We got the connector.
That white thing you saw earlier that we said would connect to the syringe, you grab that and you put it next to that and you connect that to that. Next.
And we got the syringe.
We get the syringe and we take off the blue cap on it, and then after we do that, we put that cap that doesn't have the blue thing anymore into the blue side of the connector, the one with the blue thing on the connector. And now it's all connected. So,
before we get in, we have to unscrew it in counterclockwise.
You have to unscrew it, counterclockwise. And then we have to take out as many bubbles as we can.
Yeah, we have to
We have to make sure to take away the bubbles without.
And that it's not clogged.
Yeah, we have to make sure it's not clogged, and to take out as many bubbles without taking out as much medicine.
if it's coming a bubble, when you push a little bit from the syringe, you just need a bubble come out, and it's right there. So that now we can plug it back in, connect it right,
and then spin it clockwise so that it connects to that line right there. And then you see this,
pump.
You get the pump that you get with the whole thing, and then you put the syringe right there and make it so that it fits snugly on there and that it doesn't be forced or anything or pushed. And then you grab that black wire thing, you grab the black wire and then you put it in that hole that's in the pump next to the syringe that is already like that when you get it. Then there's going to be a button that says start or test. You can start it like start and test. You press it once, kind of hard, not too hard and not too soft, and then a yellow light starts flashing right there. That means that's on. And then later, like the next day, when it turns off, it makes like a ding sound, and that light stops flashing. That is the most important indicator, when the light is flashing or not. And you're done. And so that is how you do the Desferal injection thing, in case you don't know how, for any reason whatsoever. So, yeah.
Well, what is a Desferal, Jonathan?
The Desferal is it's like a type of chelating medication. It's supposed to reduce the iron in your blood in case you have a disease like me called chronic iron overload, which is a severe version of iron overload where you have too much iron in your blood and organs, and it can get to a dangerous level due to too many blood transfusions. Having blood transfusions in general, you get extra iron from the blood, which then